My name is Elisabetta Munzone. I'm a medical oncologist working at the European Institute of Oncology in Milan, Italy. So I think that one of the biggest challenges nowadays is, for me, according to my experience, is the high cost of clinical trials. This is a big challenge because the clinical trials are no more affordable with the resource that usually we have. We have to rely only on clinical trials that are promoted by pharma company, and also the academic clinical trials are no more affordable. So because they are becoming very complicated, there are a lot of inclusion criteria, also with the increasing of the biological complexity of the tumors. Also there are a lot of efforts that should be done also to include the patient in clinical trials. Also, the problem of the costs is really a huge cost that also prevent us as medical oncologists to perform clinical trials that could be useful for clinical utility in the everyday clinical practice. So I think that this is the point, this is an important challenge that we should face in the next years. So one, according to my opinion, is also to design pragmatic trials that are simple trials to answer simple questions that are relevant to the everyday clinical practice, and for example, comparing to standard of care treatments where there's not a sufficient clear idea what is the best of the two. So answering questions that are relevant to clinical practice and through these pragmatic trials. And the other point is also using clinical data from the real world data from for example, for the health electronic records, for using artificial intelligence tools that now are improving and are performing quite well in extracting data from the health electronic records. And this could also give us as clinical oncologists, medical oncologists, the possibility of using relevant real-life clinical data also to perform this pragmatic trial that could be very relevant in clinical practice to answer very simple questions.